Ron Margalit, I'm the CIO of Evergreen Nephrology. I've spent 25 years in healthcare, from workers' comp to primary care to specialty care. Evergreen Nephrology partners with nephrologists and payers to deliver value-based kidney care to those with chronic and end-stage kidney disease, working to show disease progression and improve clinical outcomes. We address today's fragmented health systems, empowering nephrologists to implement best-in-class interdisciplinary clinical resources and analytics tools. Evergreen is leveraging advanced AI tools and EHR systems to support data sharing and accessibility, enabling care coordination and sharing across the different systems.
Cool. And so nephrology, dealing with kidneys.
Correct.
I love that there's like that we can kind of dive in a little bit about the use of some innovative technologies and tools and AI and everything in a specific use case and modality in healthcare. Often we'll talk about on the Talking Health Day podcast about different models of care. And so it's interesting that you raised the point around the value-based care as well. I'd love to unpack a little bit more about like what a space of nephrology and kidney care really needs and why some of those different modalities of care or technologies might be a useful application in that. Like, tell me a bit more about like the trickiest problems that need to be addressed.
With nephrology, data is key. There's a lot of lab results, a lot of fragmentation in the systems between the various platforms out there.
Yeah.
And finding a good way to create great documentation and close the care gaps and give the providers what they need to be able to give the patients the best care possible.
Yeah.
So we're doing that by providing AI tools for coding and quality and centralizing the analytics across our partners.
And so we here at HIMSS, we're seeing different uses of technologies to address, similar challenges, I guess, but in different areas of healthcare too. Love to, understand a little bit more from your side, attending HIMSS and seeing different applications of technologies in healthcare, where you're seeing some interesting kind of use cases, particularly with your own background in technology and seeing, different parts of healthcare too. What's really catching your eye that you think will have a really meaningful impact, whether it's in nephrology or just more generally in healthcare too?
I think the data sharing, the increased amount of vendors that are able to consolidate data across platforms and clean the data so that it's normalized and consistent across them rather than fragmented pieces all stored in different ways. Even simple things like lab results, different units of measures across different platforms. The more we can clean that data up before we ingest it and produce analytics off of it, the better it'll be. I've been looking at a lot of ingestion platforms and data normalization platforms and how they're leveraging newer technologies to speed that cleanup.
Yeah. And looking then at, attending HIMSS, it gives you a good opportunity to connect with a lot of the ecosystem and thinking about your own use case in the nephrology space. What kind of people are you looking to connect with here at the event, and what do you find in the conversations you're having, like whether it's with people directly in nephrology or related, like the problems they're trying to address that you might be able to help with?
Yeah, I haven't run into too many people in nephrology. Yeah, I actually have a meeting later today.
Okay.
So I've been working with meeting different people that can help us solve some of our current needs, connecting multiple EHRs. We have a wide ecosystem of EHRs. Not all have the best connectivity and data sharing. So we're looking for unique ways to pull that data out and bring it to the level that like the Epics and the Athenas and ECWs have today. We probably have about 7 or 8 different EHR platforms we're supporting, and they all have different capabilities. So the more we can find tools that help us bring those capabilities to the similar levels, the better off we are.
And I find that too, like particularly with like different technologies that can address really specific use cases of healthcare. It's not like EMR providers or practice management systems can be hyper-focused in every, niche of healthcare. So it's, imperative that partnership and that seamless integration is there too, because I know from all of the EMR providers, their play is definitely to provide the platform, the ecosystem to be able to enable solutions like this to be able to then connect in, because all that data is going to be super important to the work that you do as well, right?
Yeah.
Yeah.
Yeah, I think it's just some of them are at different levels than others, and we're trying to leverage the most amount of data we possibly can to feed to our other tools. The more consistent the data is we give to our coding and quality tools, the more consistent our results for our provider partners can be.
And lastly, then looking into the future, where you see this space going, what kinds of innovations or developments do you see in your platform that will happen over the next 6, 12, 24? What can we look forward to seeing?
I think heavily around analytics and what we're able to do with data.
Yeah.
And the integration of feeding data back to provider platforms. That's been a challenge in the past that's beginning to change, where you can push data back into whether it's their EHR or their care management platform. And I'm looking for opportunities of how we can make the provider's experience seamless so they're not going to multiple systems.
Yeah.